Come on in. We're going to take a tour of the Vein Center. Here we have our waiting room, which as you can see is very comfortable and homey. We try to make the patient feel relaxed, and that's very important when they're coming in to have their veins checked. So come on back. This room here is our procedure room, and this is a room where we're going to be doing our laser procedures, our VenaSeal procedures, as well as closure fast. All that is done here, and the equipment is all ready to go. And as you can see, it's also a very comfortable environment for our patients. We're going to move down here. This is our consult room. We have a specific room set aside for consultations. And this is a little different than most practices because we come in here and spend a lot of time with our patient. We have to make that patient feel comfortable at home and feel like they're queen for the day. And while they're here, I also give them a free copy of the book that I wrote that helps them understand their condition. This is very important because there's a lot of misinformation about venous disease, and we have to clear that up for our patient and educate them as to what we're going to do next. This is a room we use for diagnostics. As you can see, we have our ultrasound machine here, and our RVT, our registered vascular technician, will do the scans, both venous and arterial. I'm here helping her, watching, and talking to the patient about what we see on the scan. Now this is another difference in most practices because you'll find that in most venous situations, the doctor will send the patient to another center for a venous ultrasound and then wait 2 weeks to get the results back, whereas we can do that instantaneously on the same day that the patient is seen in the office. And we have the results right away, which means we make the diagnosis right away, and then we can get the patient treated. Moving on down here, we have a special room set aside specifically for cosmetic sclerotherapy. And you can see another comfortable setting in here so that the patient is relaxed, and the patient will be here for about a half an hour for each treatment and receive cosmetic sclerotherapy injections to her legs. This is done by a registered nurse that has over 30 years experience with sclerotherapy. So just to let you know, this is our comprehensive approach to venous disease, and this is where we do it. And if you sign up for the Vein Center Academy, you're going to have one-on-one instruction by all of our staff, and you'll be top-notch in your profession. See you here for your training.